1 in 4 older adults reports falling, and more than 32,000 older adults die from fall-related issues. Every second an older adult falls in the United States. And because of some of this data, the CDC recommends that all and older receive a screening for falls risk on a yearly basis. So if you're 65 years and older, you should be screened for falls.
So here are some of the risk factors that might put you at a higher risk for a fall. Of the highest, if you're 85 years or older, if you're a woman, or if you've ever had a fall. A previous fall is a good indicator that you could fall again. And then if you have a history of some of these specific medical issues, they include having a stroke, Parkinson's, diabetes, depression, and heart arrhythmias, dementia, or incontinence. Some of the risk factors that you can control and perhaps change would be having any walking or balance issues, might be why you see a physical therapist, leg weakness, especially in the lower half of your body. Polypharmacy, that's defined as taking more than 4 medications a day. Vitamin D deficiency, not getting enough sunlight, having any visual impairments, especially if you wear glasses, if your prescription is not up to date. That is a big risk factor that you could fall, not seeing things clearly, could be causing some dizziness. And that's an easy thing. You just go see your eye doctor and get that updated. Any foot issues or improper footwear, we'll talk more about that. And then home hazards. We have a whole slide about that as well. So this checklist is small print, but I've given you all a copy and we're going to go through it together. You can check mark yes or no on the questions here. So let me get a copy.
Is that going to need a pencil or a pen? And we are not collecting any of these items. This is really for your personal knowledge. You're kind of self-screening here, okay?
So, starting at the top, any falls in the past year? If you're worried about falling, if you feel unsteady standing or walking, it's just yes or no. And then in the next section is medical conditions. If you have a problem with your heart rate or you have an arrhythmia, cognitive impairment, this could be thinking, memory, if you have issues coming up with the right word, that's all cognitive impairment. Incontinence, rushing to get to the bathroom, leaking when you sneeze or cough, having issues with your bowel or bladder, that's all incontinence. Depression, foot problems, if you don't feel your feet well, numbness and tingling, you have lost a toe, that could all be included. And then there's some other medical problems that you think that put you at increased risk. This next section you might go through with the doctor, but if you know what medications you're on, you can check yes or no. It's all medications, so psychoactive medicines, opioids, medications that cause sedation or confusion, medications that cause hypotension, that's low blood pressure.
So that means, so you're saying any medication that lowers your blood pressure to a lower level than normal. Okay. So if you're on high blood pressure medication, does that count to bring it down to a normal level?
It shouldn't.
Okay.
Cause normal, like you're saying, not low blood pressure. Okay, so the next section is testing that a physical therapist would complete with you. We're not going to have yes or no to that today, but in the future, we're hoping that we could come and do a more active session with you all and go through some of these tests. So I'll explain. The timed up and go is a walking test where we see how quickly you can go 10 feet and sit back down. And if you're kind of slow with that, it indicates you could have a fall. The 30-second chair rise we use to measure your leg strength and endurance. If you can't complete a certain number of those, it could indicate a fall. And then there's a balance test of how well you can hold yourself up in a few four different foot positions. So we would do that with you at a later date, hopefully. And then there's two more, your vision, like we talked about. And if you have postural hypotension, that's where your blood pressure changes too drastically when you go from laying down to sitting, sitting to standing. You might get that lightheaded feeling. So that's this checklist. And if you feel like you have a lot of yeses, you might be at risk for a fall.
Does anybody have any questions about any of those factors that she just talked about that maybe you're not clear what it means? This is a good time to ask. Okay.
Here now, we're going to have plenty of time for questions and discussion at the end. And, you know, don't say it right away. We will definitely talk at the end. Okay. So the study initiative, I mentioned that briefly before, and that's just something that the CDC has come up with to help address this falls issue in older adults. And what does STEADY stand for? It stands for Stopping Elderly Accidents, Death, and Injury. And I mean, that's kind of straight and to the point. It kind of tells you the exact name right there in the title. So where it came from is the American Geriatric and the British Geriatric Societies created this guideline for prevention of falls. And the CDC created this STEADY initiative, which is based on those guidelines. And what did those guidelines show? Well, it showed that they could do a 24% reduction in the rate of falls when they followed them. So, you know, the hope would be that if we follow some of these guidelines and you go through the appropriate steps to prevent falls, that you could prevent your falls by that much. So the STEADY initiative is kind of a three-part process. First, you screen for fall risk. Then, if something seems to be needing more further assessment, you would go into more testing measures to further assess that falls risk. And then, based on what's found in those assessments, you would have some interventions in order to hopefully prevent those falls. So today, we're really focusing on the screening part, just because it's a large group. We only have so much time. So we're kind of having you all do this self-screening part, but that will help you know, do you need further assessment and maybe intervention for falls? So the screening tools, we're going to go over pretty much all of those together. And then the assessment tools are a lot of what AJ has spoken about already, that tug test, 30-second sit to stand, the 4-stage balance, and that's often what a physical therapist might perform with you. So as AJ mentioned, our really end goal is that we could make this into a bigger event and do maybe like a once or twice a year clinic where we actually provide those assessments here, do those tests. But today, just with in the interest of a shorter amount of time and a larger group, we're just doing the screening. Another form of assessment is assessing medications, home hazards, blood pressure, vision, your feet and footwear, vitamin D, and any other comorbidities or medical issues that might be in your past history. Now, something important to think about when you look at this is that this is kind of represents a team approach. So this might be a physical therapist helping you with some of these things, but it also might be your doctor, maybe a pharmacist, maybe you're talking to your podiatrist. So it could be a variety of professionals helping you with these things.
So just out of curiosity, how many of you would like to have the opportunity to have them come back and actually do these assessments with you. If you're interested, raise your hand. Okay, and it would be free service. It's just something they would come and help us with, okay? All right, so I think we're gonna go ahead and try to get that scheduled because I really think that this is, and I think you'll agree that we wanna prevent every single one of you from falling if we possibly can, right? Or minimize that risk. So I'm excited that you're willing to do that, to come back twice a year. That'd be awesome.
Okay, so going further down that screening route. So there's two big screening tools we're going to use. One of them is that 12 questionnaire that you have in front of you. We'll go over that momentarily. And the other one is actually a very brief screening process via 3 questions. And Jackie actually asked some of them right in the beginning of this. So have you fallen in the past year would be the first question. And nobody has to answer out loud. If you want to, feel free. But just at least internally answer these questions to yourself, okay? Do you feel unsteady when standing or walking? That's the second question. And the third question, do you worry about falling? Are you fearful of falling? So with those 3 questions, if you answered yes to any of those, even just one, that's considered at risk for falls. Okay? So now we're going to move on to the 12-item questionnaire, the state independent questionnaire that you have in front of you, and we'll go through this together. This is just a little bit more thorough screening tool. And one thing that I really like about it, you guys are excited. One thing that I really like about it is it has the questions on one side, and then it has why it matters on the other side. So we're going to go through this, and then you can score yourself up. Yep.
You said that you're at risk. So I'm assuming the first thing, have you fallen in the past year? Doesn't mean like you tripped over your cat or something like that, right?
Any fall to my.
A fall is defined as going from a high point to a lower point. If you had to catch yourself on your bed or your countertop, that really actually is a fall. Those little catches count. If you were trying to stand up from your chair and you fell back into your chair, you didn't end up on the floor, still counts as a fall. So you want to be honest with your doctor about those.
Remember, this is a screening tool. So just because you answered yes doesn't mean you are automatically you're like going to fall forever. It just means like we need to assess this further is all that means.
Yes, in that situation, if I may step in, if you fell over your cat, was it because in the past could you have done the same thing and not tripped over your cat if you were in the same exact scenario, right? Because that way that's telling you something about your physical condition or the way your brain's working. So
going through the questionnaire together, we're all going to do it. The first one, I have fallen in the past year. If yes, circle that. If no, circle that. People who have fallen once are more likely to fall again. That's the why. Number 2, I use or have been advised to use a cane or a walker to safely get around. Again, people who have been advised to use an assistive device may already be more likely to fall. I like to place a caveat here because I don't want you to think that just because you maybe don't use an assistive device and should be using an assistive device doesn't mean that puts you at less risk to fall. If anything, it might be more likely. So using an assistive device itself is not a bad thing. Sometimes I feel unsteady when I'm walking. Unsteadiness or needing a support while walking at times of decreased balance. Okay, that's the why. Next one, I steady myself by holding onto furniture when walking in my home. Similar reasoning here. That might be a sign of poor balance. I'm worried about falling. So people who are worried or fearful of falling, less confident in their fall, and their ability to not fall, can have a higher likelihood of falling. So that's one thing actually that we test for often in a physical therapy assessment is your actual confidence level that you won't fall. That's an indicator of falls in itself. I need to push with my hands to stand up from a chair. Again, this is a sign of maybe some lower body weakness, some functional weakness. I have some trouble stepping up onto a curb. Again, that could be a sign of some lower body weakness, all which can indicate a little bit higher falls risk. I often have to rush to a toilet, rushing to the bathroom, particularly at night when the lights are dim or off. You're disoriented because you've been sleeping, you're a little groggy. That's a high risk for a fall at that point. And interestingly enough, people don't often think of it, but if you're having some bladder incontinence, in some cases, that can be something that's addressed with physical therapy too. And we do have a pelvic floor physical therapist on Pittsburgh location. So don't write that off as this is not a therapy thing right away. Next, I have lost some feeling in my feet. So that's maybe you have some diabetes, some neuropathy, but numbness in your feet can cause you to not be able to feel the floor so great and maybe stumble and cause a fall. I take medicine that sometimes makes me feel lightheaded or more tired than usual. And some side effects can increase, some medication side effects can increase your risk of a fall. I take medicine to help me sleep or improve my mood. And as AJ mentioned earlier, some medications are recommended to be limited in the older adult population because they can increase risk of falling. If you're really interested in that, I recommend talking to your doctor or your pharmacist about it. There's a really well documented list called the Beers list of medications that are really not appropriate most of the time in the older adult population. Last one, I often feel sad or depressed. Symptoms of depression, such as not feeling well or feeling down, are linked to falls as well. So there's kind of a really broad variety of factors that can be linked to fall. So as you answer that in your head or on the paper if you'd like, go ahead and add up the columns and you'll get a total number at the bottom. Now, if you get 4 or above, that indicates that you may be at risk of fall. Now, if you do not, if that's not the case, you're less than 4, but you've fallen within the last year, that still indicates that you've been at risk for fall. So those two things, either more than 4 or less than 4, and maybe you had a fall in this last year, those would indicate you need a little bit further assessment regarding your fall risk. Okay.
Then there's what we can do about it. And we made this brief list of what physical therapy could do for you. If you've got the weakness, especially in your lower half, such as getting up on a curb, getting out of a chair, those things seem tough for you, physical therapy can help. If you have issues with your balance or walking, you don't feel steady, you kind of use the furniture to help you get around, physical therapy can help with that as well. If you have any dizziness, that's where I have a lot of extra training. That's where I really like helping people. And if you're experiencing dizziness, that's something therapy can help with. I'll talk more in detail about that. If you use an assistive device or maybe need an assistive device, physical therapy can assess that need. Maybe you have a cane but should be getting a little more help. Physical therapy will work through that with you and what's most appropriate. Or if you're using a walker, but you could get better and you need less than a walker, we would make those goals with you. And then footwear and home safety recommendations. We have a lot of extra training in what would be safe recommendations for you. And it'd be personal to your home setup and what you experience and use on a daily basis. And then furthermore, there's some evidence-based fall prevention. We've talked about the CDC recommendations of these are already proven research programs that reduce risk for falls. You may have heard of Tai Chi. I think they offer that class here for you all. And then there's Otago, which I'm certified in. It's a balance and strengthening program. And then there's stepping on. There's a lot of different variations for what would work best for you. Coming to physical therapy, we could work on those things with you. Just some pictures, some ideas. This is Tai Chi over here. This is some balance work. We can do yoga if that's what you like. And there's some strengthening programs, sitting or standing, depending on your physical abilities. So we just really tailor it to what's appropriate for you.
Okay, so assistive devices. We brought a few with us, and we'll talk briefly about most of the ones up here on the screen. I'm sure you're probably familiar with some of them. I see a rollator, cane, we got some in here already. Let's start right at the top. Next to that assistive devices is a reacher. And that would be a great tool if you have not the best or no wheels. Then you walk over on your porch. Okay. As you go from each and every one of them. So the first one, excuse me, the first one, no wheels. So it's a walker like this, and no wheels. The positive of that is it's super steady. It's not going to go anywhere and put your weight on it. The negative is that you're going to have to probably pick it up and put it down every time you raise it. And that takes some balance to stand like this with nothing on the floor. The second one is the one I have right here. It's a rolling walker. This is a well-loved item in therapy clinics because it kind of combines both. Excuse me. So it gives you a little bit more stability, but it still rolls. So you don't have to pick it up, which means you don't have to have amazing balance. And it's pretty sturdy. The only negative really about it is it's kind of wide, it's a little cumbersome, be a little harder in tight spaces. So it is a little more cumbersome, like you mentioned. Now that last one with the 4 wheels, the rollator, that one's going to be like very mobile, it's going to be quicker, which is wonderful. However, if your balance isn't great, that might not be a wonderful item for you because it's going to be pretty mobile, less stable. So it really, again, it depends on the person. It depends on your needs, what's going to be best for you. One thing I really love about the rollator is that it has the seat. So if you're someone who has maybe some endurance issues, maybe you have a history of COPD or heart failure or some neurological disorders that make it so you kind of need a seat more often, it has a fair motion. So you can walk and then sit as needed. Yes, sir.
The rollator, what's good about that? It has brakes on it.
Yeah, it has brakes. Yeah, as long as you lock the brakes, then it is a good thing. If you leave them open, you're in big trouble. But yeah, that's a really nice perk of it as well. So those are the 3 types of walkers we usually see in clinic, and we might recommend if we were to see you as a therapy patient. We also have some canes up top left here. The first one on the left, standard single point cane, and then the one next to it is a 4-point or quad cane like this. There's benefits and negatives of both, of course. The first one, the single point cane, is a little bit more mobile, easier to negotiate, but it usually topples over if you just leave it on its own. Got to hang it on a table or something like that. The benefit is it stands up on its own, but it's heavier. It is again a little more cumbersome than some other things because it's a little bigger on a step. It's a little bit harder because you just got to get it just right so it fits on the step. But you can put a little bit more weight on it if you were to need that. So there are some, again, pluses and minuses to this, just like everything else. And in the far right corner over there are what we call lob strand crutches. Those are kind of like getting to have a cane in each hand, but they hook right onto your forearms. And they allow you to have a little bit more natural walking pattern than, say, a walker would. Another thing that does that, and these are AJ's gloves, so I'm sure you can go on a tangent. Yeah, these are trekking poles. Similarly, they can also give you a nice, more natural, reciprocal gait where you get to move your arms and legs. You did point out yesterday that they also allow you to have much better posture generally than, say, a walker, which tends to wind up like this a little bit more. So there is pluses and minuses to both. They are generally a little less stable than walkers. So again, this is why often it's good to see maybe a therapist or a professional because we can really recommend what would be best for you, tailor it to you. Okay. Footwear. So this picture is showing the National Health Services in the UK. I just really loved, I felt like it summed everything up I wanted to say about footwear. So overall, footwear can increase or reduce your risk for falls if you're wearing appropriate footwear, great. But if you're wearing something that's too big or small, that's really old and worn out and slippery or has a high heel on it, that can increase your falls risk. So what do you want in a shoe? You want to make sure you have a shoe that's well fitted for you. It should have not a big heel on it, okay, something low. You want it to be able to fit your foot well, so it should fasten to your foot, like say Velcro or laces, but it might also be like they make elastic laces now. So maybe you have trouble tying your shoe. There are still options for you that make it an appropriate shoe for you that could be up your alley. You also want them to have a thin, firm, non-slip surface. Of course, I think everybody knows that one. And especially if you have a history of diabetes, maybe, you really got to be paying attention to your footwear and your feet on a regular basis.
So an open heel is a good idea, right?
We want you to prefer something that closes around the back.
So you don't want to wear something that's open in the back because your foot is more apt to slip out of it, right? So that's why sometimes we'll talk to people when we see you walking in, if you've got, you know, the ones that are easier to get on because you can just put your foot in, but it's also easier to have come off your foot.
Something that fastens it on and stay on your foot and doesn't flop down is ideal.
Right, so the next slide is about your home safety. We have printouts of this to take with you. You can take it home today and maybe check through some of these things of what you can change in your home to make it safer. So looking at stairs or a little threshold to get in and out of the front door, you want to make sure that you either have a bar there, a railing, or you put some tape down so you can see where the elevation changes. That might help if you have poor vision. Some colored painter's tape, that usually helps. If any of the step has carpet that's pulled up a little bit, you want to get everything fastened down so you don't have a spot to trip over. If you have a rug at the bottom of your stairs, We do not recommend that. You want to get up any of those grow rugs. Things around the house, extra clutter. If you have small pets, you just have to be mindful of where your foot could get caught. Okay, and lighting, that's one of the next things on this list. You want to have good lighting at night, a night lights left on in the bathroom if you don't have night lights. Maybe a flashlight in your bedside table if the power goes out. My patient yesterday just told me she fell because the power went out with the storm and she didn't have a way to get to the bathroom. So new plan, flashlight in the bedside table. Okay, making sure you have railings near the tub or your toilet. Maybe you have a counter there, but something to push from or hold on to when you have to step over the tub. Okay, that's a good spot for it. If you have flooring in your house that goes from tile to carpet or hardwood to carpet, that can be hard for your body to adjust to. And it might be a place where you think, what can I change? Whether you can pull up the carpet or not, or put that painter's tape down again so you have a visual that it's going to change. But you want to be mindful of those changes where it goes from smooth to bumpy. Okay. And then talking about the kitchen, if you have things up on a high shelf, not ideal. You want everything at waist height. Reaching up overhead pushes your balance backwards. It can also make you dizzy. That's something you deal with. So you want to move things that you use often to waist height. Maybe you have a family member that can help get things out of the oven if it's low. You just want to be mindful of what's challenging to you. Try to adjust if you can. Okay. Bathrooms is the last checkpoint. Making sure you have the non-slip rubber mat, or they have stick-ons for the bottom of the tub. Something to keep you from slipping. Okay, that's really safe. So this is available up at the front table to take home with you if you want to look through things you can change. As promised, I'm going to talk about some dizziness. It's now the number one reason someone 75 or older goes to see their doctor. It's surpassed low back pain. Dizziness has a lot of causes. It could be that you don't drink enough water, dehydration, so the number one cause of dizziness. It could be medication related. It could be inner ear related, vision. The inner ear is a space where physical therapy can help. It's called your vestibular system, and it works just like the rest of your joints. It has cartilage in there, which is what your joints are made of. And so it has that ability to get worn out, get the wear and tear, knee pain, shoulder pain. Your inner ear can get the same thing. So we exercise it, and we can tailor the program to be what's your deficits. So whether it's your eyes and ears keeping up with things together, or it's turning your head, looking up overhead, getting up from a chair, rolling out of bed. We practice all of those things, and we give you homework so that it gets better. Very treatable. It takes about 4 weeks, and then we can work on your balance as well. So if that's something that you're experiencing, you're just going to ask your doctor to come see me at Siler City. But it is treatable, and it unfortunately is very common, especially as you get older, because of that wear and tear that your inner ear deals with. And if you have other deficits like neck pain, so you don't move your head as much, you're at higher risk for dizziness because you're not practicing moving your head. So that inner ear gets weak, not knowing your equilibrium at all times. Something to think about, something we offer at the Siler City Clinic. The one other thing that's on here is that postural hypotension. There's testing for that. If you get dizzy or you feel lightheaded getting up from your chair, or whoa, if I stood up too fast, you gotta catch yourself. That's so common. It might be medication related, it might be blood pressure related. And so we can talk about that and work on that a little bit just to get you safer. pretty common.
There's actually a handout on that at the front as well. So if you feel like that might be something that you're dealing with, there's a good handout on hospital hypertension. Okay. Our services. So obviously we are very partial to therapy, but I mean, I do really feel like in the prevention of falls department, we have a lot to offer. Not that you shouldn't be speaking with other professionals, but physical therapists can help so many aspects of this issue. So I want to tell you a little bit about specifically our clinic. So if you really are screening, like you might be a falls risk and you're interested in seeking out some physical therapy, you know how to find us. So we have two clinics, both under UNC and both under Chatham Hospital. And our rehab departments are located at Siler City at the Chatham Hospital over there in the medical office building. And that's where AJ and I were. But we also have another location in Pittsburgh. I assume most of you are going to be closer to Siler, but you know someone or someone else that may be closer to Pittsburgh, we have a location at the Chatham Park address as well. And if you're looking at the slide, top left would be the medical office building at Chatham Hospital here, where we really live. And then the top right is our Pittsburgh location. The Chatham office has the benefit of being right next to the hospital, so we have very close relations with hospital-related staff, primary care there, other services in this location. And actually, our staff, for the most part, actually works in both the outpatient clinic here in that picture and also up in the hospital. So it's very possible that you don't ever wind up in the hospital, but if you were there, you might see us there for physical therapy as well. And it might lead to an outpatient referral in our outpatient building to work on falls. So our Siler location has PT, OT, and speech therapy. So PT, we've talked a lot about it already. OT, that still might be a piece of the puzzle for you. Maybe you have some difficulty with dressing or bathing or cooking, cleaning, and maybe you've had a history of a stroke or something that impairs one of your hands or arms. That could be still an important item for you. Speech therapy could also have a place for you as well. If you had any cognitive issues or difficulty with thinking or speech, that could be something that you might want to be able to address at our location as well. So the beauty of that location is you have all three of those there. You can see them all together if you like. Our Pittsburgh location also offers speech therapy, but at the moment we don't offer occupational therapy there. And both of us offer Monday through Friday appointments. The Siler Clinic is also starting to look into some Saturday appointments, but we haven't really got the ball rolling there quite yet, but it might be something that occurs in the future. And I have our phone numbers up there as well. Now that brings me to the question of how would you perhaps get a referral? Maybe you're screening that you might be at risk of falls, and now, we've done our job of sold you on therapy and you want to come see us. So we have this up front here. And this is just kind of an informal referral to either of our locations. It's more just so you have something with all of our information to leave with. This way you can go to your doctor and say, hey, I went to this falls thing, and I think that I might be at risk for falls. Do you think that I would be appropriate for getting some physical therapy? I live in Siler City, so I'd like to go to the Siler City Clinic, and here's all their information. And that's our phone number, our fax information. And we also have the Pittsburgh location on here as well. Most doctors will obviously take this, look at it, and say, oh, okay, sure. And then write you their own prescription or put it in their electronic medical record there and electronically send it to us. And that's fine. So don't feel like you need this. Most doctors are probably not going to fill out this exact sheet. But if they do fill out this exact sheet and they want to fax it to us, or you want to walk it into items on the bottom, kind of give your doctor ideas on things that you might need help with, like weakness, walking training, balance and falls risk issues, so things that therapy can really help with, pain, endurance, dizziness, as AJ mentioned, and pelvic floor issues. So of the two clinics, we each kind of have slightly different populations we work with and things that we see often. Our Siler City Clinic, I'd say, see more neurological issues, maybe some Parkinson's, some stroke, different issues like that. We see more dizziness, vestibular issues generally, and we generally see a more older adult population as well. Now our Pittsburgh location does some of this as well, but they also see a more orthopedic population generally. Then we have an orthopedic certified specialist at their location as well. Now the only clinic with pelvic floor therapy is Pittsburgh. So if you did need something in that area, you would still speak to your doctor about it, but you would have to go to that clinic for sure. Okay, that's all our info. Last slide is all about questions. Before we answer any questions, I just wanted to remind you all of our references so we can make a true reference guide. Just all this information is really mostly from the CDC, particularly their STEMI initiative, and those evidence-based falls prevention programs. There's a really nice list of them on the National Council on Aging's website, and I even printed it off if you're really interested, that like Otago that we do, or if you're interested in a specific Tai Chi program or stepping on program and want to lift those things up in your area, you certainly could use that website to do it. So that's the only kind of references we have today. Thank you guys for all sticking through it and listening to us talk for so long. We'd like to use the rest of our time to answer any questions you have that are general. And at the very end, we'll take a little time to come up and look at any of the devices, or you have a personal question you want to ask us a little more privately, you can do that too. But for now, to the general room, any major questions or things you guys want to discuss?
Yes, to the young lady. I have a cane, but as long as I'm walking on something level like this, I feel like I don't need it. But if I'm walking on the ground, I feel like I need it. Yeah. And the dirt and all that kind of stuff. But I'm going to get dependent on a cane. Help me.
Yeah, that sounds great. So that's where physical therapy would be great, because we can practice outside and practice in the mulch, and we have foam pads to practice being on a squishy surface to get your balance better, that you're confident enough to not need a cane. If you keep one in your car and just use it outside, that's great too.
We don't have one in the car, I got one in the kitchen, and I got one in the room.
There you go.
Really well.
That's okay too. Yeah, if you want to work on getting away from a device, that's where some exercise and balance training would be great. Yeah.
Anyone else? I think I saw a question back there.
Sure.
I wanted to ask you, can you just give us the paper to work out at home with?
So
For that?
we certainly can, but therapy tends to be really tailored to you. So I wish there was like a magic 5 things that I could put up here that you could do, but it's really tailored to you. So even if you want to just do something at home, I would recommend you get a therapy referral and just tell the therapist that on your first day, like, hey, I'm not really interested in coming, but can you just give me some things to do at home? And then they'll evaluate you, we'll assess your balance, your fall risk, and then we'll give you a nice tailored printout for you just to say, okay, we'll do this at home, if you need more, come on back. The things that we have up on the table there are pretty much, and what we went over here, are the most generalized, everyone can benefit that you can really do from afar like this without assessing you. Again, if you want something a little bit more tailored exercise-wise, that would really require an evaluation.
Because you may be falling because of the weakness, or because of your feet, or because of balance, or it might be dizziness. So it would have to be specific.
Yeah, I think, you're right.
Mhm.
Hurts in my legs when I start walking.
Yeah.
So what can I do for that?
Yeah, so we would want to test your abilities specifically so that we know what to recommend. We wouldn't want you to waste time doing things that aren't of value to you. So
Is there, so does, I think a lot of people here on Medicare, does Medicare cover a certain number of visits with physical therapy a year?
yeah, they're very,
Medicare doesn't have a specific cap anymore for therapy, as long as things are, as long as we are rationalizing it and validating that the person continues to need services, generally, you're pretty well covered by Medicare. So yeah, we love our older adults and love our Medicare.
And I'll just share, somebody who comes to my 8 o'clock exercise class, she's dealt with pain in her legs for a long time. And she would get pain in the front of her legs and in her hips. And she finally went to a physical therapist and found out that what she was doing wrong was she was walking on her toes and she wasn't having a proper gait of hitting her heels and then rolling to her toes. And once her physical therapist showed her that, it got rid of the pain that she's been dealing with. I've been to a physical therapist over and over in my life for different things, for injuries, for pelvic floor issues. And I'll tell you, if you've got something in your life that's bothering you and you have not told your doctor, if you've not asked to see physical therapy, you're missing out, because they have got so much knowledge about the physical body and how to correct things or improve things, strengthen things, that you're living a subpar life if you're not making use of them. And that's why I wanted to know about the Medicare, because I'll tell you, I mean, I used to have pain all the time, and it was working with physical therapy and then starting exercises. And I really respect what AJ was saying about, you need to have a personal, like, I can do general exercises with you. I can't do what they do with you. I can't say this particular exercise is going to strengthen this particular body part and going to fix this for you. They can do that. And then you can take what you learn from them and apply it to what we do together.
Thank you for that, by the way. That was very generous of you. But I really, we love helping people. Obviously, AJ and I really love the older adults with balance and falls population. And what we do is really try to start you in therapy and then give you things to continue with at home. You'll have to continue to exercise. But the goal is not to keep you coming forever. It's to hopefully fix things and then allow you to continue on with a healthy and happy life afterwards.
And I think that's really key. If you, and what you mentioned initially, is if you take and you go in and you say, like Judy, if you go in and you say, this is what's bothering me, I would like to know what I can do at home. That's going to be part of their goal, is to get you in and out and get you doing it on your own and knowing how to do it correctly so that you don't hurt yourself.
Yeah.
And you can see the improvement.
I used to do it at home, but I lost the paper now.
I'm sorry if you come to this early. What is the definition of pelvic floor?
It's going to cover a variety of issues specific to this population. I have mentioned that incontinence and the bowel bladder issues. If you talked a little bit about this earlier, but I feel like you can't get into the bathroom, sneeze and a little bit of urine comes out. Some of those issues can be addressed at least partially with pelvic floor therapy. So that's, I think, for this population where pelvic floor therapy can really be beneficial. Yeah, I mean, like any other part of therapy, they examine you and you will do possibly an internal examination too, which you have to approve of course. But that our pelvic floor therapist is specially trained in that, has got extra training for this. And yeah, they would prescribe you exercises. And it might be a little different than you think of as exercise, but they would definitely prescribe you different things to do to try to address that. Yes, sir.
A person I know recently had an accident sitting on a roller coaster. And
Sitting
I'm
on a
curious about how likely that is to happen.
A rollator?
Really, I had to learn a new word.
Rollator, okay.
It means a walker with wheels and brake levers and sometimes with a seat, as this one does. She said she was sitting on it and she stood it up. And it turned her over backwards. She hit her head on the pavement. Had to go to the hospital to check for concussion. I'm thinking,
It is not meant to
is
move.
that like, how likely is that? How much of a danger is that happening?
Absolutely, it is meant to stay in one place when you are sitting on it. It is not meant for someone to pull you, for you to. Yep. So it is likely that if you sit on it and try to move at the same time, it can tip. The back of it is just a bar, it's not a seat with a back to it. So it can wobble for sure.
And that's where, when they get a device like that, working with a physical therapist to actually know how to use it safely is really, really important. That's why if you go in the hospital, usually they'll call a physical therapist in and you get a few lessons on how to do it, because there is a way to latch the brakes so that they hold. A lot of times, based on where I used to work, the brakes don't always stay tight and they start to move, and you need to have they can a lot of times adjust the brakes to make sure that they're tight, because you don't, when you're going to sit on it, it's like trying to sit on a rolling chair. You can land on your butt really easy, so you want to make sure that it's fast and then you sit down.
I think it's really a matter of education. It's like anything else, like most tools can be dangerous. So if you have one like this lovely one here, it's just, you just need the proper education on it. Maybe your friend unfortunately didn't know that you shouldn't push and wheel yourself around on it. And that's not really what it's meant for. But education is a really big piece to using these devices well. And if you use them appropriately, I mean, I can't say you're never going to have a fall, but it would be very unlikely that you would fall out of it if it was the right way.
And that brings up a good question, because we have a loaner program through the Council on Aging where people can come to us and they can get a rollator, they can get a walker, they can get a rolling walker. We give them information to go with it, but we don't prescribe, we don't train. And I'm gonna have to bring that up to our council and see whether we require people to have a prescription versus the people are saying, I think I need one of these things. And I don't know the answer to that. So I'm gonna check on that. Yes, it's called durable metal.
But yeah, hold on, we have a question right here. What was that one? Yeah, now if there's like a structural issue, if your bone is shaped like, a little differently at this point, we're not going to change a structure, but a lot of times, like an alignment issue is also partially due to muscular imbalances or posture, and that would have a big effect on. So I would say if your knee is bothering you and you feel like it's kind of starting to be looking a little funny, it's certainly worth trying some therapy, and most doctors love therapy because we're low risk, high reward. It's not a surgery. So if you talk to your doctor and just say, my knee's bothering me, I feel like it's pointing in, and maybe I'm having some pain when I walk with it, they'll probably be
Pretty cool, Phyllis.
It's making it worse. Yeah, I mean, I think that you are probably appropriate person to maybe try some therapy and see what they can do for you. Again, a full evaluation that can give you, here's what we can do, here's what might not change. We're usually very honest, like we won't change this, but we can change this. So I think it's worth it. Worth trying to see what we can do, what we can offer you. Yeah. Any other questions before we wrap up here?
And that's the pelvic floor exercise, you know. So if you're having incontinence issues, I know we offer the pads, we offer, you know, the pull-ups and things like that. They're valuable and they're helpful for us. But I can tell you, I had severe incontinence issues before, and learning how to do Kegel exercises correctly and working on them, that's no longer an issue. So I bring it up. Yes, it's personal data, but it is so freeing to know that I don't have to worry when I see. I don't have to worry when I fuck anymore, you know, and that I don't have to rush to the bathroom. I have my core muscles back. I couldn't find my stomach muscles for a while. And a physical therapist had to show me, because I was having such back pain, that all of my core muscles had disappeared. And she said, tighten your belly. I said, I don't know how to do that anymore. And she showed me how to do it. And little by little, I got my core muscles back. I don't have lower back pain anymore. So that's why I'm really, you know, if you're living with pain, if you're living with incontinence and you haven't seen a physical therapist, you're missing out. Okay. So it's just really, really key. Any other questions? And I would like to have them back to do the testing, you know, the fall prevention testing. I think that would be really valuable, and then maybe to give people specific exercises, and then if I know which exercises they're doing, then I can incorporate them into routines. We like to do something like between 10 and 10:30, so we can work on the ones that you think would be the most beneficial, because I want to do what's going to really help. Absolutely. So any other questions or comments? So what was your one takeaway? Did anybody figure out your one takeaway, what you're going to do when you leave here? Does anybody want to share? My takeaway is I'm going to get them scheduled for the other things. That's my takeaway. All right. What was that?
That's great. Thank you.
All right. Anything else? Anybody else got a takeaway? Who's going to talk to your doctor and ask them for a referral? Anybody here want to show a hand? You don't have to, but if you want to, because then what I'll do is I'll check back with you and say, how'd you do? Did you talk to them? Okay. Sometimes it's good to be accountable to somebody. I'm happy to be your accountability partner.
Well, thank you all for your attention and participation. We appreciate it.
An excellent audience. We really love your engagement.
Let's give a round of applause. Woo-hoo!
These papers up front for another couple of minutes. If you want to grab them, please feel free.
Does anybody want the paper so you can bring it to your doctor to ask them to give you so you can go see them? Anybody want this one? All right. What about the postural hypertension when you stand up and you get dizzy? Does anybody want the one on that? Okay, Bill. Anybody else want one on that? No. I'm trying to tell you what's up here so you don't miss out. All right. Anybody else want this one? Okay. Anybody else? This is for the postural hypertension. It helps you when you're dizzy. All right, we'll look at that. So that's the one that you go from sitting to standing, you get dizzy or